And we are live, Senator.
All right, this is health and welfare. We are back looking at H86, the speech language pathologist and audiologist compact. Cameron, why don't you pick up where we were, and we'll because of our limited time, let's take a higher view. We'll go up to 50,000 feet, and that will be helpful.
Okay, great. So I believe, oops, I need to share my screen. Otherwise you won't see what I'm looking at. Right. All right, so we left off in the definition section. So definitions, starting on page 3, going through page 4, into page 5, and 6, and 7. There are a lot of definitions in this particular compact. Section 4503, this is state participation in the compact. So this is what the state must do in order to participate in the compact. So see there are requirements in here around background checks and communication and use of the data system. And then from page 8 into 9, we start talking about what requirements an audiologist must have. I'm flagging this now because you will see a section later in the bill that amends our statutes a little bit in terms of what an audiologist must have for licensure and participation in the compact. So those requirements for audiologists are on page 8 into page 9. Excuse me, into page 10. And then on page 10, you start having the requirements for a speech language pathologist to participate in the compact. So you'll see that's listed here on page 10 into page 11.
Okay. I have a question about the those folks involved in education. And so if we do have this compact, can someone from out of state by telehealth be contracted as a district special ed person?
So the question is, can a licensee under the compact from out of state participate or, excuse me, provide services by telehealth
For a school district.
for a school district?
Yeah, let's just say that, for, contracted to a school district, that is possible.
So if that is currently permitted by law, that an out of state, someone who, a licensee who practices, resides out of state, currently has a Vermont license to practice, and if our current Vermont laws allow that person to participate by telehealth, then that would go unchanged by the compact. That makes sense.
Okay, I'll think about it. Okay.
Okay. I can look at that more too as well.
Yeah, that'd be helpful.
Looked at it from the telehealth perspective. So the remainder of this compact really sort of bundles audiologists and speech language pathologists through all of the sections.
Yeah.
So you'll see that they're both referenced for most of the remainder of the compact language. Similar to all compacts, you'll see in this section, there's a requirement that the audiologist and speech language pathologist have to, are under the jurisdiction of the licensing board, the courts, and the laws of the member state where the client is located. There's a common theme among all of our compacts. The section 4504 compact privilege on page 12. This is where you will see the requirements for both an audiologist or a speech language pathologist they must meet these requirements in order to exercise the compact privilege. So you'll see that's listed. Those requirements are listed on the bottom of page 12 into page 13.
Mhm.
And also within this section, you have procedures for applying for a license in advance of a change in primary state of residence. So there's some process there. This also has the compact privilege is valid until the expiration date of the home license. The licensee is subject to the remote state's regulatory authority for services they provide there for a client within that state. Similar to the previous compact, you still have the requirement that the home state license can't be encumbered and that you need 2 years to have elapsed from the date of any adverse action in order to be able to exercise your privilege to practice. So here we have, this is our telehealth section. So section 4505 on page 15, member states shall recognize the right of an audiologist or speech language pathologist to practice those services in any member state via telehealth under a privilege to practice as provided in the compact and rules promulgated by the commission. Section 4506 is once again about active duty military personnel or their spouses in terms of designating a home state. Section 4507 concerns adverse actions and explains the remote state's authority as well as the home state's authority to take adverse actions against a licensee and the consequences of taking those adverse actions on other privileges to practice. Section on page 16 into 17 also covers joint investigations so that member states may participate with each other to conduct joint investigations of a licensee. Section 4508 on page 18 is establishing the compact commission. Very similar to the previous compact language that you saw for physical therapists. In this case, however, each state gets 2 delegates rather than 1, selected by the state's licensing board, which for our case is the Office of Professional Regulation.
So is this different, having 2 delegates? So how was that decided? Is that just the way it was? Well, it's because we have an audiologist and we have a speech pathologist?
You'll see that 1 is required to be an audiologist and 1 is a speech language pathologist. Okay, so then we go through several pages of requirements for the commission itself in terms of powers and duties. You'll see here on page 20 into page 21 into page 22, and then language and requirements in here around an executive committee in terms of what those duties are and the composition of those members on the executive committee. And that goes all the way down through page 25 and 26. We're talking about commission duties and powers in terms of the operation of the commission itself.
Let's go last year.
Section 4509 is our section on the data system, once again requiring a coordinated uniform database and reporting system so that member states may put in licensure, adverse action, and investigative information on all licensed individuals in their member states. So once again, requirements here on page 28 into 29 for what information each state must put into the data system. And then requirements on page 29 about notification of adverse actions and investigative information and how member states may access, contribute, or remove information from the data system. On page 30, we have section 4510. This is the rulemaking section. This is for the commission promulgating rules that will become binding on the party states. This section outlines the process for promulgating rules in terms of public notice, posting on websites, what notices need to include, having a public hearing, when that hearing needs to take place. So that goes down through page 32 into page 33. There's also emergency rulemaking permitted in here under certain circumstances. And that goes down to page 34. And then section 4511 is the oversight, dispute resolution, and enforcement. This just outlines the commission's role in dispute resolutions for disputes between member states. And then section 4512 on page 35, this is about implementation of the Interstate Commission, which is, as you've heard in previous compacts, coming into effect on the date on which the compact statute is enacted into law in the 10th member state. For this compact, we already do have more than 10 member states that have adopted this compact, although I don't believe that this is one of the ones that is quite up and running yet. But you'll hear more about that from the Office of Professional Regulation. Like all the other compacts you've heard, a member state may withdraw from the compact by enacting a statute repealing the same, which would be repealing this subchapter from chapter 87. The withdrawal, would not take effect until 6 months after the repeal. Section 4513, construction and severability, which means that the provisions of the compact shall remain in effect, even if some provisions of it are found to be either unconstitutional or otherwise invalid. The remaining sections would remain in effect. Section 4514, this was not a section that you saw in the previous compact, so it's the binding effect of compact and other laws. And this section says that nothing prevents the enforcement of any other law of a member state that is not inconsistent with the compact. I believe the other compacts also do say that all laws in a member state that are in conflict with the compact are superseded to the extent of the conflict. Section 4515 on page 37 into page 38, this is some state-specific language that we are enacting outside of the compact language itself. So this is concerning Vermont's administration of the compact. So in this section, once again, we're having the Office of Professional Regulation having the power to oversee the administration and the enforcement of the compact within Vermont. To recover from the affected audiologist or speech language pathologist the costs of investigations or disposition of cases. The director of the Office of Professional Regulation is the entity that will be responsible for designating the 2 delegates, 1 audiologist and 1 speech language pathologist for the state of Vermont. Section 3, as you may recall from when I first started this, because audiologists and speech language pathologists are under separate licensing statutes within Title 26, we had to cross-reference within one section to the other section so that everyone is aware that there's a compact for both of these professions without us putting the compact language in twice into statute. So section 3 here is adding a subchapter which just adds that Vermont is a member state of the Audiology and Speech Language Pathology Interstate Compact. So applicants for a privilege to practice audiology shall be subject to the requirements prescribed under chapter 87, subchapter 2, which is the compact language. So then section 4 was one of the amendments from House Healthcare. This was at the request of the Office of Professional Regulation. Similar to physical therapy, the Office of Professional Regulation needed specific authority to conduct the criminal background checks that are required under the compact. So you'll see here that adding audiologists and speech language pathologists as professions that the office may inquire into the criminal background histories for licensure, for initial licensure and for license renewal. And then section 5 was also an amendment from House Healthcare. This has to do with the specific compact requirements for audiologists. In Vermont currently, to be eligible for licensure as an audiologist, an applicant only needs to have a master's degree or equivalent in audiology or speech language pathology from an educational institution. However, this compact requires that for someone to be eligible for the privilege to practice, that they have a doctoral degree in audiology. So to recognize that some people may want to exercise the privilege to practice, Vermont needs to have something in its statutes that says in order to that someone can be licensed as an audiologist if they have a doctoral degree in audiology or equivalent doctoral degree, regardless of name from, there's the explanation. But the point being that our current law does not have the requirements that are required by statute for someone to exercise the compact privilege in this instance. So this is new language to allow for that new requirement in the compact. Sections.
So if somebody from Vermont is going out of state, they've got to have a doctoral degree to go out of state, but they can still practice in state with a master's degree.
They can still practice in state with a master's degree. They would not be able to participate in the compact.
Oh, so I'm sorry, I missed that. The compact requires a doctoral degree in
Yes.
audiology to be a licensed audiologist.
Yes.
Yep.
What about speech language pathology?
Masters.
No.
Just masters?
We went by it.
Sorry.
Yeah.
It's
I
all
could-
right.
I'm getting-
Go back and look.
We understand. We'll clarify that as we go forward, but.
Okay.
It is further up in the bill.
Okay.
Like it is in here what the requirements are, but I don't recall.
I'll say that on the floor report, further up in the bill.
Is this yours? Okay.
Whatever.
That's good.
Section 6 is an amendment from House Ways and Means. Currently, there's a $240 biennial renewal fee for audiologists and speech language pathologists. However, for the compact, for the privilege to practice under the compact, a licensee of a remote state only has to pay the biennial $50 privilege to practice fee. And then section 7, the effective dates. So the compact language itself and all of the extra sections that we needed to add in order to make it all work together. And the fee section are not effective until July 1st, 2024, to allow for some background operational issues to get handled. And then the remaining sections are effective on July 1st, 2024.
Okay, thank you. And Ellen, you're gonna eventually get us a fiscal note on each of these.
Actually,
Got some.
they've all been sent to Alex.
Right.
They've all been posted. And they've all been posted, so
We're golden.
there's a fiscal note for 62, 77, and 86, and then there's a memo that summarizes the fiscal impact of all three in one place.
Perfect. And
fantastic.
we're getting another one on Radiologic something.
Well, so postpone until next Wednesday.
Okay,
So I don't know how that meets your crossover deadlines, but
we'll see what happens with that.
it got postponed.
Okay, all right. Thank you. That's great. So question, and then I have a question. Go ahead.
Quick question, process question. So yes, we're receiving the House bills from crossover. What's the timeline to react to a House bill?
We can
Yeah.
hold it over until January.
Okay.
Yeah,
Yeah.
anything that's in, that we have now up there is still up there going forward. We'll also be getting other bills, so, yeah.
Okay, how about to reach to be included into the big bill, the finance bill?
Well, we're going to have to act on it, or at least send a message down there that it's coming. So,
By a certain point, it's like,
well, we're gonna be shut down in about 3 or 4 weeks. So we've
Okay,
got a
that's
heavy lift to do before.
okay,
we
thank
can
you.
be okay.
Can I add to Senator Weeks's question, which is how do the House bills interplay with the Senate bills that haven't been for example, the psilocybin bill, how do we
Because
prioritize
that bill
those?
is still there, and
Right.
it will still be there in January. If we have time, there are some of the bills up there that are S bills. We may be able to hear about those. I doubt very much that we'll have time to pass any more S bills to the rules committees, but we'll, January, we start in again.
So the House bills would take priority over the Senate bills that haven't,
Yeah,
okay, gotcha,
and after crossover.
okay.
So I do have a question, Ameren, on the all of the compacts, and that is, we have all these compacts, they're going on, and I know that there must be information posted on the OPR webpage or on the compact webpage, and I'm just wondering how to get that information to us. So how do we get that, the compact information, something accessible to the committees of jurisdiction? Thinking about what can we put in statute that would direct it to be somewhere that's easily accessed, whether it's a separate compact section on the OPR page or the Board of Medical Practice or whatever page. I'm not sure, but I think in my case, I would really like to be able to go out and find all the compacts all together in one spot and whatever. I don't know if we can do that. Just a question.
Yes, I think you could direct the Office of Professional Regulation to include on their website a page which outlines or lists all of the compacts that the state is currently participating in, with links to commission web pages or something to that.
Okay,
But
that's something to think
That
about.
That would be
doesn't help
nice.
you if you haven't passed the law yet and you want to find information. That doesn't help you now, it's down the road.
What do you mean?
So you're talking about after we pass the compacts, you want to be able, or you want to know for now, so you can prep for passing the bills.
I want to know after the compact law is
Okay.
passed, I want to know
And
where,
Ameren's suggestion is good.
yeah, that's it. No, I don't need to, yeah, good, yeah, thanks. Okay, anything else for Ameren on compact? We're good, thank you very much. And so we're gonna go offline